It was a day of jubilation and hope. But as South Sudan prepares to celebrate 10 years of independence on Friday, rights organisations have warned the country's health sector is in ruins. The oil-rich nation gained autonomy from Sudan in 2011, after more than 2 decades of fighting. But by 2013, civil war had erupted, leading to an estimated 400,000 deaths and one of the worst refugee crises in the world. Under-resourced public health services that existed before independence have been further decimated by conflict and a lack of investment. According to the International Committee of the Red Cross, only about 40% of South Sudan's pre-independence healthcare centres remain functional. For recent mother Nyalel Chol, that meant a long journey when she fell sick.
When I was pregnant with my son, I got so sick that I had to go to Lear, a neighbouring village about 25 miles away, to get treatment. There was no means of transport, so I walked all the way and spent the night on the journey.
The UN's Children's Fund warns that 4.5 million children in South Sudan desperately need help to fight off malnutrition and opportunistic diseases. Mads Oyen, UNICEF's Chief of Field Operations in South Sudan, says the situation requires urgent international attention.
We are actually going through the worst humanitarian crisis since independence 10 years ago.
Even better equipped and staffed facilities are overwhelmed. At the Juba Military Hospital in the country's capital, ICRC surgeon Dr. Belene Asefa has been treating a patient who arrived with a gunshot wound. He says ICRC teams often fly patients to the hospital, but that due to logistics it can take days for them to arrive. And in this case, that led to complications.
We have no option. We have to offer him the best treatment, which was amputation. But we are not here for not amputation. We are here to save lives, to save limbs.
The ICRC says it's provided surgeries for about 9,000 people wounded by weapons since the world welcomed its newest country in 2011.